Hello everyone, Assalamu alaikum. Welcome to Agnetics Live. আশা করি আপনারা সবাই ভালো আছেন. So today is our last session of Comprehensive Language of Medicine course, and we are going to discuss Chapter 7, which is going to be Musculoskeletal System. As you can see at the caption, there is a URL link, which is the course assessment ending quiz. So I would request all of you to attempt the quiz at the end of the session, and you can submit your quiz answers by tonight 11:30 p.m. All right, so let's get started with chapter 7. So chapter 7, Musculoskeletal System. So the objectives today are introduction, classification of bones, joints, ligaments, and tendons, the pathological conditions, laboratory tests, and some important abbreviations. So what is a musculoskeletal system? So this is the combination of muscular and skeletal system together, and it includes bones, muscles, joints, tendons, ligaments of the body. And what are the functions of musculoskeletal system? So as you can see, it has been highlighted here. It provides the shape or framework of our body. Number 2, it protects our internal organs. Number 3, it helps in movement because muscles are attached with it. And lastly, the bone contains a jelly-like substance known as bone marrow, which is usually red in color, could be yellow as well, but the red bone marrow has a function of hemopoietic activity, so it produces or manufactures blood cells. As you know, we have 3 types of blood cells, which is red blood cell, white blood cell, and WBC and platelets. So these are the functions of musculoskeletal system. Next, we have classification of bones. So there are actually several classifications, but since musculoskeletal system is a vast chapter, so in this short span of time, I'm going to try to cover as the important ones. So in that case, we will be discussing the classification according to location at first. All right. So the classification is cranial bones, facial bones, vertebral column bones, which we discussed in chapter 2. Then bones of the thorax, which has been discussed in respiratory system, bones of the pelvis, which has also been discussed in chapter 2, and lastly, bones of the extremities. Okay, so let's have a look. So cranial bones. So before reading the slide, let's have a look at the image. So as you can see, cranium means skull. Okay, so these are the bones of the skull. So number 1 is frontal bone, which is basically forms the forehead. So this is 1 in number. Second, we have parietal bone. These are 2 in number, which is immediately behind the frontal bone. And then at the dorsal end or the posterior end, we have another bone, which is 1 in number. This is known as the occipital bone. And then we have the temporal bone, which is again 2 in number. This small passage or hole or foramen, this is the auditory canal. Okay, so the ear is attached here. All right. Then we have the sphenoid bone. This is again 1 in number. If you can recall, in endocrine system, the sphenoid bone has a cavity or a area where the pituitary gland is located, known as the sella turcica. And lastly, the ethmoid bone. This is usually 1 in number, and the olfactory nerve or the nerves of smell passes through this plate. Okay, so these are the bones of the cranium or skull. All right. So the bones of the skull or cranium are known as cranial bones, and these are attached together by suture joints. So basically, suture is, as you can see here, the zigzag lines. It seems like someone has, stitched it. All right. So these are suture joints. All right, the zigzag lines. There are 8 cranial bones. So number 1 is frontal bone, 1 in number. This makes the forehead. Then parietal bones, 2 in number. These are attached on either side of the head and behind the frontal bone. Temporal bone, this is again 2 in number, and there is a small foraminal hole there, which is known as the auditory canal. At the posterior end, the occipital bone is located, and then we have sphenoid bone and ethmoid bone. All right, so these are the 8 bones of the cranium. Next, we have facial bones or bones of the face. All right. So what are the facial bones? There are actually, other facial bones as well, but for PhD face, we are going to focus on this 4. So as you can see, this is the nose, and the bone is known as nasal bone. The anterior part, the one that is missing, that is actually a cartilage. So this is not shown here. So only the bone part is shown here. This is the nasal bone. These are 2 in number. Then we have the yellowish region here. This is known as the maxilla. Okay, if you can recall respiratory system, we discussed about maxillary sinusitis. So the sinus is located behind this maxilla. Okay. All right. So this is maxilla. This is also 2 in number. Then we have the zygomatic bone. Okay, the prominent region near the cheek region. So this is the zygomatic bone. And lastly, we have the mandible. All right, so mandible is a movable bone, the only movable facial bone, because there is a joint here, all right, which is known as the temporomandibular joint. So this bone can actually move. As you can see, the teeth, these are attached with the maxilla forming the upper jaw, also with the mandible forming the lower jaw. So these are the facial bones, and the common bone for both the facial and the cranium is the frontal bone. Okay, so this is the common bone for both. Okay. Next, we have bones of the vertebra, which has been discussed earlier as well. If you can remember, there are 5 segments. At first, the cervical region, the neck region, it has 7 vertebra, C7. Then we have thoracic vertebra, which is 12 in number, T12. Then we have the lumbar vertebra, L5. Then the sacrum, where the 5 bones have been fused and there is no disc in between. And lastly, the tailbone or coccyx, which is a redundant bone, and also here the 4 coccygeal bones are fused together. There is no disc. All right, so what is disc? We already know discs are cartilage-like substances which acts as shock absorber and are present between 2 vertebra. Since between each space is known as inter, if you consider it as a prefix, so intervertebral disc is disc located between 2 vertebra. All right. So these are the discs, the blue color regions, as you can see. But in sacrum and coccyx, if you see the image, you won't be able to find any discs here because these are fused bone. All right, now let's move to the next part. Okay, before that, these are separate vertebrae, if you can see, and this hole, this is the spinal column or vertebral column. Through this holes, the spinal cord passes. Okay, continuation of the brain. So each vertebra looks like this. So depending on the region, the shape of the vertebra changes. Okay, so usually this sort of vertebra is present in the cervical region. Okay, this in the thoracic and this in the lumbar. These are not that important for now. It's just for having a good knowledge about it. Okay, then we have a little bit more details of the vertebral column. So this is a disc. Okay, and there are 2 portions in a disc. So for PhD phase, you don't have to know that. And as you can see, just posterior or behind the disc, there is a bundle of nerves. This is known as spinal cord. Okay, which is descending from the brain. All right, this is the spinal cord, this yellow region. Okay, and this section, this is the spinal cord. Okay, so these are several sections showing the disc and the spinal cord. So basically the disc is very closely related with the spinal cord. If there is any issues or any disease related to the disc can actually compress the spinal cord, leading to several diseases. Okay, so very common if a person has a road traffic accident, suppose in the lumbar region, suppose a car hit him from behind, if the disc pushes towards the spinal cord, all right, in that case it could actually tear the spinal cord, which is very dangerous. Okay, all right, could lead to paralysis. So these are the parts of the vertebral column and the discs. Okay, next we have bones of the thorax. This has been discussed as well. So as you can see, the thoracic cavity formed anteriorly by the chest bone, posteriorly by the spine, 12 thoracic vertebra, and sideways or laterally by the 12 pair of ribs. Okay, we have 12 ribs here. The first 7 are the true ribs because these are directly attached with the sternum, and 8, 9, 10, these are the false ribs because these are attached with the 7 vertebra and not directly with the chest bone. And lastly, we have the 11th and 12th vertebra, and these are not attached in front, so these are the floating ribs. So we have 3 types of ribs here: true, false, and floating. Now, a little bit more details of what we have left in respiratory system. So as you can see, the chest bone, okay, this has been divided again into 3 parts. As a whole, you can call the chest bone as sternum, okay, but the upper part of the sternum is known as the manubrium. This part is known as the body of the sternum, and the lower pointed end is known as the Ziegfeld process. So for now, if you remember sternum or chest bone, it's going to be fine. Maybe in pre-HT training, we will discuss it in more details, okay. Now, there are 2 more important structures of the thoracic cavity or rib cage, which I'm going to show now. So this is the other image where these 2 structures were missing. So as you can see, the clavicle is also attached with the chest bone or the sternum. Okay. In case of male, the male person, the clavicle is known as the collarbone, and in case of female, this is known as the beauty bone. But you know, we won't be able to use this layman term, so in that case you have to use clavicle. Okay. Next, we have another bone, the wing bone. This is known as the scapula. Okay, there are 2 scapula behind the thoracic cage, and this helps in formation of the shoulder joint. As you can see, this is a bone of the arm, okay, attached directly with the scapula. All right. Okay. Next, we have bones of the pelvis or hip region. This has also been discussed before. So as you can see, this is one hip bone, this is the other hip bone, 2 hip bones, and posteriorly we have the sacrum. These 3 together forms the pelvic cavity. All right. So as you can see, the hip bone has 3 parts. The first upper portion is known as the ilium with the I, which is different from the ilium with the E, which is part of the small intestine. Then we have ischium, the lower segment, and finally pubis, which is this segment. Okay, the location of pubis should be a little bit more towards the center. So this is the pubis. All right. Then, as you can see here, the hip bone joins with the bone of the thigh, which is known as the femur, and this forms the hip joint. Okay, so there are 2 hip joints. And then as you can see in the image, we have the lumbar vertebra, okay, L4, L5 here, and this is the sacrum. So these are part of the hip bone. So most importantly, you have to remember ilium, ischium, and pubis. Okay. All right. And inside the pelvic cavity, we have the bladder and reproductive organs. Okay. So let's have a recap of how much we did till this part. So we did the introduction, what musculoskeletal system is. So this is basically muscle and skeletal bones together, including the joints, muscles, tendons, ligaments of the body. Then the functions, it forms the shape and framework of the body. It protects our internal organs, and then it helps in locomotion or movement. And lastly, it helps in hemopoiesis or blood cell formation. We have 3 types of blood cell: red blood cell, white blood cell, and platelet. Okay. Next, classification of bone. So we have discussed up to pelvis. Let's have a look. So in case of cranial bones, as you can see, there are 8 bones here. Frontal 1 in number, parietal 2 in number, temporal 2 in number, occipital 1 in number, sphenoid and ethmoid 1 in number. So there are total 8 bones. And this is the auditory canal where the ear is attached. Okay. All right, next is facial bone. So this is nasal bone, this is maxilla, this is mandible, and the common bone is the frontal bone. Mandible is the only movable bone. It forms the lower jaw, and maxilla forms the upper jaw. Also, maxilla contains a cavity known as the sinus. If infection occurs in the sinus of maxilla, this is known as maxillary sinusitis. All right. Then we have the bones of the spine. So it has been divided into 5 regions: cervical C7, thoracic T12, lumbar L5, sacrum S5, and coccyx C4. So in case of sacrum and coccyx, there is no intervertebral disc. These are fused bone. But for the rest, we have a disc which helps as a shock absorber and is located between two vertebrae. Okay. All right. This is the spinal cord, which is a bundle of nerve descending from the brain. Next, we have bones of the thoracic cavity. We have the chest bone or sternum, 12 thoracic vertebrae, and laterally by ribs. Ribs are of three types: true, false, and floating ribs. Then we have two more bones here for the thoracic cavity, which is clavicle or the collar or beauty bone, and we have scapula. Next is the pelvis. So hip bone has three parts: ilium, ischium, and pubis. And hip bone helps in formation of the hip joint, okay, with the femur. Now, bones of the upper extremity. What does upper extremity mean? Okay, which basically means, the upper arm, forearm, and hand. So that is the upper extremity. And if you consider the lower extremity, it usually means the thigh region, leg, and feet region. Okay, all right. So in case of upper extremity, as you can see, it starts with a joint. This is the shoulder joint, as I've discussed before. The scapula joins with the humerus, which is the bone of the upper arm, okay, or arm, forming the shoulder joint. We have only one bone in the arm, okay. Then forearm. Forearm has two bones. The one which is at the outer region, that is known as the radius, and one in the inner region or towards the body, this is known as the ulna. Okay, so two bones in the forearm. And lastly, we have other bones in the hand, which will be discussed in the next slide. Now let's have a look at the three joints formed in the upper extremity. We have the shoulder joint, which is formed by the scapula and the humerus. Also, a part is being, given by the clavicle. Okay. Second, we have elbow joint. This is again formed by the humerus, lower end of the humerus, and the upper end of radius and ulna. This is the anatomical position, but if you consider the position of the bones by raising your hand upwards, it's going to be the opposite. So anatomically, we have to point our fingers downwards to find the location of the segments of each bone forming the joint. Okay, so this is the elbow joint, upper part of the radius ulna, lower part of the humerus. And lastly, we have the wrist joint. Wrist joint is again from lower part of the radius ulna and upper part of the hand bones. So these are known as the carpal bones. We'll discuss it in the next slide. Okay, so these are the three joints and bones. So in case of upper arm, we have humerus, then we have forearm, which is basically formed by radius and ulna, and three joints: shoulder, elbow, and wrist. Now let's have a look at the hand bones. So as you can see, this is the radius and ulna. Okay, all right. So these are the carpal bones, the small bones here. And then we have near the knuckle. So these are the bones called metatarsal. So there are five metacarpals. Then for the fingers, we have these bones. These are known as the phalanges. Okay. So for now, if you can remember carpal, metacarpal, and phalanges, it would be more than fine. Okay. And this is the wrist joint formed by the radius ulna and carpal bones. So as you can see, the anatomical position here is opposite. Okay. So in that case, if you rotate the picture, then the proper position of the segment of the bone can be identified. Okay. Next is classification of bones for lower extremity. So in case of lower extremity, we have the thigh region, the leg region, and the foot. So thigh, in the thigh region, we have femur, okay, one of the longest bone. In the leg region, we have fibula and tibia. And in the foot region, we have, name of bones which are similar to the hand bones. So we have tarsal, metatarsal, and phalanges. So as you can see, phalanges is common for both hand and foot. So in case of lower extremity, the joints formed here are, so number one, we have hip joint forming here, which is formed by the hip bone and the femur. Okay. Then we have another joint forming here. This is known as the knee joint. Knee joint is formed by four bones. So as you can see, the lower end of femur, upper end of tibia and fibula, and a small bone, a P-shaped bone. This is known as the patella. Okay, kneecap, right? Patella. So four bones form the knee joint. And lastly, we have the ankle joint. This is again formed by lower end of tibia and fibula and the tarsal bones. Okay, so we have three joint here, similar to upper extremity. So one is hip joint, knee joint, and the ankle joint. All right. Okay. Next are some other structures which are also important in musculoskeletal system. So we have joints, ligaments, and tendons. So before reading the slide, let's have a look at this image. So as you can see, this is a joint here, okay, formed by two bones, femur, tibia, and fibula. So here, this is a knee joint. Again, if you consider this image, this is a humerus, this is ulna and radius. So this is the elbow joint. Okay, so joint is basically articulation between two or more bones. Okay, so as you can see, there is a joining or articulation of the bones. So these are joints. All right. This is another example. This is a knee joint. Okay, this is a femur and this is tibia and fibula. This is another knee joint, a little bit more detailed. So this is the tibia or the shin bone. Then we have the fibula, and this is the upper end of the femur. Okay, uh, this is basically a very superficial bone, and you can actually feel or palpate the tibia by your own hand. Okay, all right. So what is joint? These are structures that connect individual bones and allow the bones to move against each other to cause movement. Next, we have two more structures, tendon and ligament and cartilage. Now let's have a look. So as you can see in the first picture, this is a ligament. Okay, so ligaments are rope-like structure which has great tensile strength, holding the bones together. Bones are very heavy, so only muscles won't be able to hold the bone together. So to have a firm attachment of one bone with another bone, we need a rope-like structure with high tensile strength. This is known as ligament. So ligament basically attaches a bone to bone. Okay. Second structure is known as tendon. Okay, tendon. So what does tendon do? They attach the bone with the muscle. So as you can see, this is a muscle. Okay, a thigh muscle, quadricep muscle, and the lower end is known as tendon, which is being attached with the kneecap or another bone. So ligament joins bone to bone, tendon joins muscle to bone. Similarly, in the next image, as you can see, this is a biceps muscle, in front of the humerus or arm. Now this bicep muscle is attached with the radius bone, again with the help of a thread-like structure with good strength. This is known as tendon. So muscle to bone. Similarly, if we consider humerus to radius, as you can see this structure, this is known as ligament because it's attached with bones to bone. Okay. So very easy to remember. If you consider bone to bone, it's ligament, and if we consider muscle to bone, it's tendon. Next, let's have a look in this image. Similarly, as you can see, this is a tendon because attached with the muscle, okay? And this is a ligament because the bones are attached with it. Again, these are more ligaments. The knee joint is one of the very important joint because it bears our body weight, okay? So there are several ligaments here to support it. Next, we have another term, cartilage. So cartilage is basically, a very flexible structure which acts as a shock absorber and usually is attached between a joint, and it covers the bone surfaces. So this blue colored structure, this is known as a cartilage, and it prevents, breakdown of the bones or protects the bone and reduces friction while movement. Next, we have more images of ligament and tendon. So this is again a ligament, bones to bone. Now this ligament is very important for musculoskeletal system. This is present inside the knee joint. As you can see, it's in a cross-shaped structure, in a crisscross. So this is known as cruciate ligament. Cruciate means crossed. Okay, so cruciate ligament. Since this ligament is in at the front, we call it the anterior cruciate ligament, and this ligament is behind. This is known as the posterior cruciate ligament. So ACL is the abbreviation for anterior cruciate ligament, and PCL is the abbreviation for posterior cruciate ligament. Okay, so these are present inside the knee joint. So as you can see, the structures, we have bone here, we have cartilage here. Okay, this structure is cartilage. We have patella or the kneecap. Then we have tendons here, and this structure, this is only present in case of knee joint. This is known as meniscus. If you if you watch football or cricket, there are a lot of players, who suffer from meniscus injury. So this is basically the meniscus, which is very prone to tear if any kind of abnormal movement occurs while doing some activities. So this is the meniscus. All right, so let's go through the slide once again. So tendon is a band of tissue that connects muscle to bone. Ligament is an elastic band of tissue that connects bone to bone and holds the stability of the joint. Cartilage is a padding between bones and protects the joint and facilitate movement. So these are the supporting structures you have to remember, for joints. Next, let's move on to the diseases. So number one is arthritis. So you already know from chapter one. So arthro means joint and itis means inflammation. So inflammation of joint together is known as arthritis. Now, two common example of arthritis is ankylosing spondylitis and gouty arthritis. Now, what does the word ankylosing spondylitis mean? So ankylose means to become stiff, okay, to become hardened, or to become more sticky due to adhesion. So it's basically more stiff. And spondylitis basically means the inflammation of the vertebral bone. So usually ankylosing spondylitis occurs in the spine, okay, the vertebral column or the spine. So there is stiffness of the joint of the vertebral column, as well as there is inflammation of the bones and joints. So this is known as ankylosing spondylitis. All right. Sorry, I couldn't provide a proper image here. So in that case, you can Google and see the image. Second, we have gouty arthritis. So gout means increasing uric acid level. If you can recall, urinary system, we discussed about the waste product uric acid. So if a patient sorry for the interruption. So if the patient has high uric acid level in blood, okay, it could deposit inside the joint, causing gouty arthritis. Okay, so let's see, inflammation of the joint caused by excessive uric acid accumulation. The uric acid becomes crystallizes to become salts, and it destroys the joint. Usually it affects the big toe, okay, this joint is known as the, if you consider this bone, here is the metatarsal bone and here is the phalanx. So metatarsal phalangeal joint, this joint is being affected because inside the joint what happens, the uric acid crystal deposits, causing inflammation of that region. All right, inflammation is usually indicated by a reddish area. So as you can see, this region is inflamed. All right, the patient has severe pain here, and the patient has also difficulty in movement. So this, the name of this condition is also known as podagra. If you break down the word podagra, so it means excessive pain in the foot region. All right. So these two conditions are important for joint inflammation. So number one is ankylosing spondylitis, which occurs in the spine, and gouty arthritis, which occurs mostly at the great toe due to accumulation of uric acid. Next, we have osteoarthritis. If you break it down, osteo means bone, arthritis means joint, and inflammation. So inflammation of the bones and joint together is known as osteoarthritis. Now, this is very common in usually in female patient, and one of the most common disease. And so what happens here, as you can see, this is a normal bone structure showing a joint. Here the joint space is normal, the cartilage, the whitish region is also normal. But similarly, if you consider this image, as you can see, there is no joint space here and the cartilage has disappeared or broken down. Okay, so what happens? There is no protection now. The bones rub against each other, causing inflammation and breakdown of the bone cells. Okay, so which could lead to inflammation and pain. All right, so this is osteoarthritis. So mostly the cartilage or the bone gets damaged. All right. This is also known as degenerative joint disease. Degeneration means breaking down, and there is loss of cartilage. So osteoarthritis is inflammation of bones and joints. Next, we have the second type of arthritis. This is known as rheumatoid arthritis, or RA in short. Now, this is an autoimmune disease. Now, what does autoimmune mean? Our own immunity tries to destroy our body parts by producing some antibodies. Okay, so let's have a look. So as you can see, this is a normal joint shape. And in this case, as you can see, the bones are getting damaged, bone erosion, and there is inflammation and swelling, okay, inside the bony cavity. Now, why is this inflammation occurring? Because our body itself produces some autoantibodies, okay, some autoantibodies which mistakenly breaks down our bones and bony structures, okay, leading to severe pain and stiffness. So this is known as rheumatoid arthritis, and the name of the antibody, which is the autoantibody for rheumatoid arthritis itself, is RA, rheumatoid arthritis factor. Okay, so if you suspect a patient having rheumatoid arthritis, we usually advise the patient to go for a test known as the RA factor test. And if the patient presents with a positive RA factor, which means the patient has rheumatoid arthritis. All right. So this is the second type of arthritis, which is rheumatoid arthritis. And the first was osteoarthritis. Now, the third one, as we have discussed before, is gouty arthritis, which is basically due to uric acid. And the fourth one is ankylosing spondylitis. So this is basically, it occurs in the spine. All right. Next, we have other diseases. So this is the structure of the spine. So as you can see, this is a normal intervertebral disc. This is a degeneration. Now, this occurs in osteoarthritis. Remember, I told you before, degenerative joint disease means osteoarthritis. So here the cartilage is breaking down, or the disc is breaking down, okay, narrowing the space, okay. This is also osteoarthritis. As you can see, the space is becoming thinner compared to the normal. And then we have another condition. This is known as the bulging disc. So bulging usually occurs in case of patient who are having, repeated stress over this region due to, movements, or, maybe people who are in activities like sports. Always there is friction of this region pushing the disc towards the spinal canal. And this could also happen, in old age people, where the bones are weak and the disc can easily slip towards the spinal cavity. All right. Next is the complication of bulging disc. This is the herniated disc. Okay. In case of herniation, as you can see, it has pushed outwards and has already, destroyed the spinal canal where the spinal cord is present, which means the nerve has been affected. All right. So today we are going to discuss herniated disc in a little bit more details in the next slide. So as you can see, herniation of the disc is also known as slip disc, also known as PLID. Now, what is PLID? Let's have a look. So the full form or abbreviation of PLID is prolapsed. So what does prolapse mean? Bulging, herniation. Okay, this is the synonym for herniation, which is prolapse. Prolapse lumbar intervertebral disc. Now, this condition is known as PLID. So what happens if in the lumbar region the disc bulges or herniates? Has to be the lumbar region, of course, because L is for lumbar. In that condition, we call it PLID. Now, what happens in PLID? As you can see, this transverse or horizontal section, this is the disc, and the herniation is compressing the nerve. Can you see? The spinal cord is emitting the nerves laterally, so the disc is actually compressing, or destroying the nerve fibers. So once it destroys the nerve fibers, what happens? The corresponding site becomes affected. So if the disc is located here and the nerve affected is on the right side, so as you can see, this is the nerve here known as the sciatic nerve. This nerve gets compressed and the patient has severe pain on the right side. So usually in the buttock region, thigh region, and the leg region. So this condition where the extremity is being affected due to compression of the sciatic nerve is known as sciatica. Okay. So prolapse lumbar disc could lead to sciatica. So sciatica will only occur if there is compression of nerves. But if the patient doesn't have nerve compression, suppose if it's a mild case, in that case the patient won't present with any kind of symptoms like this. Okay, these are in case of severe cases and usually needs surgery known as laminectomy. Okay, to get rid of the symptoms. Next, we have laboratory tests. So let's have a recap of the diseases. All right, so we discussed about arthritis and the types of arthritis. So number one is ankylosing spondylitis. Number two is gouty arthritis, where uric acid level is very high and it crystallizes inside the joint, leading to a condition in the great toe known as podagra. Then we have osteoarthritis, which is inflammation of the bones and joint, and usually it occurs in old patient and mostly in female. And the other name is degenerative joint disease. Then we have rheumatoid arthritis, and this is due to autoimmune reaction by production of autoantibodies. The name of the autoantibody for this condition is RA factor, rheumatoid arthritis factor itself. Then we discussed about the different conditions of the intervertebral disc. So could be degenerating, could be thinning, or could be bulging or herniation. So herniation is important for this chapter. So in that case, this is also known as slip disc or PLID. Now the abbreviation for PLID is prolapse lumbar intervertebral disc. And if a disc prolapses and compresses the nerve, could lead to compression of the sciatic nerve, and this is known as sciatica. Patient would present with severe pain and numbness of this region. All right, so this is the buttock region, thigh, and the leg region. Now, what are the tests important if you want to detect any disease? So the very common test is complete blood count, CBC. All right, in that case, you can see the level of the blood cells. If WBC is high, which is white blood cell, usually indicates that the patient might have some infection. If a patient has decreased RBC, which means the patient is suffering from blood loss. So these are important. Okay. Next, we have ESR, which is also a component present in CBC. The abbreviation is erythrocyte, which is red blood cell sedimentation rate. Now, ESR is usually very high in case of rheumatoid arthritis. You don't have to know the details for now. I'm just saying it for the proper understanding. Then we have serum calcium, level of calcium and phosphorus. So bones contain calcium and phosphorus. If a patient has less calcium and phosphorus, which means the patient is suffering from osteoporosis, usually occurring in female due to deficiency of calcium in the diet and phosphorus. All right. Then we have rheumatoid factor test, RA factor present in case of rheumatoid arthritis. And now we have creatinine. All right, why is creatinine important in musculoskeletal system? Because suppose patients who are suffering from bone or joint pain might take some painkillers. That if a patient takes a lot of painkillers, it could affect their kidney. So in that case, to assess the function of the kidney, we have to go for serum creatinine test. Then we have uric acid, which would indicate if high level is there, it would indicate the patient has gouty arthritis or gout. And then some x-rays of the cervical region, lumbar region, and then we have MRI to detect the nerve condition in case of PLID. All right, CT scan could also have a clear image of PLID and any form of fracture. And lastly, we have BMD test, which is bone mass density test. So in case of BMD test, what we usually do is we have to check whether the patient's calcium or other minerals are normal or not, and in that case the doctor can actually detect whether the patient has osteoporosis and can predict the risk of any kind of fractures. Okay, so BMD is also important for the calcium level. So these are the very important tests for musculoskeletal system. All right, next we have some images here. This is X-ray cervical spine. Okay, as you can see, this is the occipital bone. Here, this is the mandible, and these are the 7 cervical vertebrae. Okay, all right. Next, this is an image of the lumbosacral spine, which is the lumbar vertebra and the sacral region. So as you can see, this is a normal image. All right, no abnormalities present here. The discs can be very easily seen here, and if there is any kind of disc prolapse, we can sometimes see it in the X-ray, but it's more clear in CT scan and MRI. All right. Okay. Next, some important abbreviations. So if you can recall, in the first few images, I showed ACL and PCL. So this is 2 types of ligament which are present in crisscross regions. And this usually A stands for anterior and P stands for posterior. All right, holds the knee joint. Then we have RA, rheumatoid arthritis, RF, rheumatoid factor, ROM, which means range of motion. So motion of the joint, whether the flexion, extension, adduction, abduction, these motions are normal or not. In that case, we call it range of motion or ROM. CS stands for calcium, P for phosphorus, and lastly we have PLID, which is prolapsed lumbar intervertebral disc. All right. So let's have a little bit of recap of the laboratory tests. All right, so discussed about CBC. Now, why is CBC important? Because in that case, there are types of blood cells present in CBC, which is RBC, WBC, and platelet. So if you consider WBC, it could raise in case of infection. If a patient has osteomyelitis, which is infection of the bone and bone marrow, the WBC count will be high due to presence of bacteria. If a patient has rheumatoid arthritis, which is autoimmune reaction, the WBC produces the antibodies. So also the WBC will be raised in this case. So that's why CBC is important. I hope I have answered one of the questions someone asked in the comment. All right. Next we have ESR. ESR rises in case of rheumatoid factor. Then we have serum calcium and phosphorus. This is important because these are constituent of the bone. So in case of osteoporosis or bone damage, the levels fall. Okay, so in that case, we provide the patient with supplement of calcium. All right. Next, we have serum creatinine. This is to assess the function of the kidney. So if a patient is taking a lot of painkillers and the kidney could actually, get affected. So in that case, we have to assess the function of the kidney if we are prescribing some painkillers. Serum uric acid usually indicates the status of gout, if a patient has gout or not, or gouty arthritis. And X-ray, CT scan, MRI, different bone condition. Usually, CT scan, MRI gives a better view compared to an X-ray. Then we have BMD or bone mineral density test. So this is to measure how much calcium and minerals are present in your bone. And for a doctor, he can detect the osteoporosis status and predict the risk for any kind of fractures. All right. And then we, saw the images, X-ray cervical spine and lumbosacral spine. All right. So here is the disc here, as you can see, the spaces. And the abbreviation, these are very important: ACL, PCL, RARF, ROM is range of motion, CAP is calcium and phosphorus, and PLID is very important. Okay, so musculoskeletal system is actually a very vast chapter. So today I tried to give you a little bit of the framework of musculoskeletal system because we have more details to it. It usually takes 2 classes to complete this chapter. So since this is a 1 hour class, so it will be very difficult to cover as a whole. So in that case, if you can actually understand at least this up to this portion, it's going to be very easy for you to comprehend, right, once you start in our training. All right, so let's have a look at the questions. All right, walaikum assalam everyone. Okay, the question here is why CBC is required. Yes, I have just answered your question already. All right, so there isn't much question. So I would request all of you, to have a look at all the lectures so far discussed, and then take an attempt of the quiz. We have, I have provided with the caption the link, and try to submit the quiz by 11:30 p.m. today. So those who get a better score would have a better benefit, in our pre-screening assessment test. So it's very important that you study at first and then attempt the quiz rather than just giving a chance and attempting the quiz. All right. So nothing is impossible. This reminds me, one of the quote of Audrey Hepburn. If you consider the word impossible, it itself says, "I am possible." Okay, so always be positive, stay motivated, and don't lose hope. All right. So I would wish all of you all the best, and take care. And thank you so much. You have been all a great audience, and this has been fantastic. The 7 sessions, and wish you all the best. And hoping to see you soon. Take care, and Allah Hafiz.